Good evening, everyone. I'm Sneha Bedi, an elected patient and a lead governor at the Royal Free London NHS Trust Foundation. On behalf of the Council of Governors, I'd like to warmly welcome you all to our annual members meeting. This meeting is being held virtually in line with the Trust Infection Prevention Control Guidelines and to prevent spread of COVID-19. At this meeting, you will hear about the incredible achievements of our staff during this remarkable year. Every day, our teams continue to deliver the very best care to our patients. During the last 12 months, along with the rest of the NHS, we got our services back on track while continuing to respond to COVID-19 pandemic. During the evening, you will hear about how we did that and also receive updates on our operational and financial performances. We will also share our vision for coming months and years. The Council of Governors add huge value to the Royal Free London. We are elected by you to represent the interest of our membership, to hold non-exec directors to account, and to support the board of directors who are ultimately responsible for your performances and our performances. The current makeup of the Council of Governors, we always share this so that you know what the demography is. The females form 54% of the council, male represents 46%, the average age of the council is 54, and the BAME representation is 33%. My role today is to present an overview of what the Council of Governors has undertaken on your behalf. Over the last 12 months, our governors have continued to carry on their statutory duties, engage with the members, provide constructive feedback to the board, and our highlights have been remarkable as well. We have approved appointments of 3 non-executive directors, and we are delighted to welcome them tonight. Baroness Claire Tyler, a life peer in the House of Lords, Dr. Mohini Parmar, Primary Care Lead and Chair of the Northwest London Clinical Commissioning Group. Sarah Rapson, Executive Director of Supervision at the Financial Reporting Council. One of our statutory duties is also to approve the quality accounts on behalf of the Trust. As Governor, we have responsibility to review the Trust performances for the past year and give feedback on the objectives for the year ahead. This is a real opportunity to share our insights and help the Trust plan for the future. What we also did is we love hearing from you, and we also set out a first membership engagement survey. We are committed to improving the way the Trust engages with you, and how do we embed that feedback that we get. We are committed to do it on an ongoing basis, and another survey would be sent out in a couple of months' time. We have reinstated Go See visits, where the governors visits various sites that the Trust owns, and we have done this for the decontamination unit at Chalk Farms. It was a real pleasure to see the hard work that the teams have put together there, and also at the emergency department at the Royal Free Trust. We continue to hold Medicines for Members events. These are the events to engage with you and to share what work the Trust has been carrying out. We showcase the groundbreaking results that research studies that Trust is taking place throughout the years and continue to do so. We also shared how dedicated our emergency department staff is and how the emergency staff department is performing. Please keep an eye on future invitations as we plan to carry out these events. So, before I hand over to presenters, I would like to share a few housekeeping points. For the event to run smoothly, you are set up on view only. Your cameras have been disabled and you've been put on mute. There will be Q&A session after our speakers have given their presentations. We have already received several questions in advance, and there is a chat functionality that has been enabled for you to ask any questions, which would be addressed at the end of the at the end of the presentations. If we are unable to answer your questions, we will share the membership inbox, so please feel free to ask those questions there and we will answer those. Before I hand over to our first speaker, I would like to thank the team who has helped organize this event and hope you enjoy this event. And I now hand over to our first speaker, our chair, Mark Lamb.
Thank you, Sneha, for that very warm introduction and overview of what a Council of Governors have been doing for the last 12 months. May I start first by warmly welcoming everyone to our annual members meeting. Thank you for joining us this evening, and thank you for your support during what has been another remarkable year for our trust. I'm very, very proud and privileged to be chair of this wonderful organization. It's my second annual members meeting, and this is why I'm so proud in particular. The Royal Free London has a fantastic history, with its foundations going back 194 years, when the Royal Free Hospital was established to provide free healthcare to those who could not afford medical treatment. So in many ways, a precursor of the NHS, which we all love so dearly. We continue to be pioneers in healthcare and world-leading research right up to the present day. And in the last 12 months, along with the rest of the NHS, our focus has been on getting our services back on track and providing the very best service for our patients. Now, this has been a real challenge, especially after the exhausting couple of years our staff have had, but their response and the response of the entire NHS over the last year has been nothing short of phenomenal. COVID-19 has still been a reality in our hospital over the past year, and we had to be well prepared for the anticipated impact of the Omicron variant at the start of 2022. Since our last annual members meeting, we've treated 3,932 COVID patients, and in total, since the pandemic began, we have cared for over 8,000. On behalf of myself and the board, we are hugely grateful for everything our staff continue to do for our communities during the most challenging period of their working lives. The year 21-22 has been described as a year when the NHS began to reset, but it was much more than that. With the shadow of the pandemic hanging still over us, the achievements of our colleagues have been incredible. Crucially, we got the show back on the road for the tens of thousands of patients who have been waiting for their care longer than any of us would have wanted. And whilst there is a long way to go, we have made huge progress in getting through the backlog. To support these efforts, we've found ways to open extra capacity at our three main sites, Barnet Hospital, Trace Farm Hospital, and the Royal Free Hospital. We've carried out procedures at weekends and out of hours, worked with colleagues across North Central London, repurposed our private sector facilities, and opened a community diagnostic centre at Finchley Memorial Hospital so we can continue to provide scans such as CTs and MRIs, regardless of how busy our main hospitals are. And there was more. We continued apace with one of the biggest change programs our trust has ever seen, delivering a new electronic patient record system at the Royal Free Hospital and upgrading the system at Barnet Hospital and Chase Farm Hospital when it was first launched in 2018. We proudly opened the £60 million Pears building, home to the new UCL Institute of Immunity and Transplantation, which is allowing world-class scientists to work more closely with hospital clinicians to develop treatments and cures for some of the most devastating diseases of the immune system, all the more important as the pandemic has demonstrated. We opened a new clinical research facility at the Royal Free Hospital, which is designed to enable complex clinical studies, including first in-human drug trials and the development of medical devices and biomarkers. We also continue to build on our strong traditions in education and training, including a successful medical support worker program for doctors from Myanmar and our first cohort of staff to start degree-level registered nurse apprenticeships. In the year ahead, we plan to build further through our aspirations for Royal Free London Academy, as we continue to aspire for excellence in education, training and development for all students, trainees and staff within our hospitals. Our commitment to helping the NHS achieve carbon net zero in response to growing threat to health posed by climate change saw us reset our green plan. And I'm pleased to be able to update on that in the context of today's COP meeting in Egypt. And as always, we have lots to look forward to over the next year. Firstly, the construction of a new Maggie Centre is in progress and is due to be completed next year. The centre will provide support to people with cancer, their families and friends. It continues our long and important partnership with the Maggie's charity. We will continue to work closely with our partners for the benefit of our patients. Caroline Clark, our Chief Executive, will talk more about this shortly. We recognise that next year is going to be really difficult for many of our staff who will be affected by the cost of living crisis, which indeed is present now. We need to do all we can to ensure that their experience of coming to work is a positive one, and if we offer them all the support that they need. This includes enabling new ways of working by developing and embedding an inclusive culture for staff, patients and carers through our policies, systems, training and development and protocols. Creating a great employee experience through a representative and supportive workforce in a safe and compassionate work environment where there is zero tolerance towards discrimination, bullying, and harassment and abuse. You will be hearing much more about this work over the coming months, and we look forward to your continued support in the weeks and months ahead. I would also like to thank the Royal Free Charity for their support throughout the year and for its amazing Breaking Point campaign, which raised £750,000 towards our COVID recovery and staff health and wellbeing programme. They have recently launched their new fundraising winter appeal, which will support cancer projects to speed up diagnoses and treatment and provide virtual reality therapy for patients receiving chemotherapy. I encourage you all to visit the charity's website to find out more and to get involved by becoming a champion. Thank you for your continued support. I will now hand you over to our Group Chief Executive, Caroline Clark. Caroline.
Great, thanks Mark, and hello everyone. I'm Caroline, I'm the Group Chief Executive, and I'd echo Mark's thanks to everybody for being here and for listening. I'm going to just try and spend 10 minutes describing some of our favourite facts about the Royal Free Group and some of the reasons why all the people you're here tonight are really, really proud to work here, as well as try and kind of describe our ambition for the future and, as Mark said, how we work in the wider health system to make sure that we serve our populations as well as we can. It's now 5 years since we established the Royal Free Group, so I do want to talk a bit about what that means for the Trust, and as I said, what the future looks like. And I'm going to give you a whistle-stop tour of a presentation that we've done to quite a lot of our staff to say thank you to them and to remind them about the enormity of the work that they do. And I hope that you'll enjoy that. So this slide describes in numbers who we are, and there are some quite profound numbers on here. So we treat over 1 million patients every year. We serve a population of over 1.6 million people across North London into Hertfordshire. I always think about it as a clock face between 10 o'clock and 1 o'clock, if London's a clock face. And of course, we have a number of national and globally important services. We do an awful lot of research here, and Professor Tim May is going to talk to you a bit about that after me around some specific initiatives, and including the clinical research facility that we opened last year, of which we're very, very proud. As Mark said, we've been supported by our fantastic charity, and again, I'd echo my thanks to the charity for all the work that they've done. Mainly, we are nothing without our staff. So we have over 11,000 staff from 120 different countries, and it is the most fantastic place to work, and it's tough at the moment, and I'll describe a bit more kind of what Mark was alluding to just now. But we are nothing without our staff, and I would take this moment just to say on behalf of the entire leadership group, thank you to every single person that works at the Royal Free. I'm going to talk a bit more about our green commitment because, as Mark said, COP27 is on, and it would be wrong of us not to mention that. But let's move on and have just a quick reminder of the history. So Mark said we were founded as the Royal Free, the first ever free hospital 120 years before the NHS was founded, by William Marsden, the same man that founded the Cancer Hospital in West London. Found a young woman on the steps of a church, couldn't get her into any of the hospitals that were open then because you either needed money or a referral from a governor, and so he founded the Free Hospital, where poverty and sickness were the only passports. We gained our royal status because we were the only hospital to stay open during the cholera pandemic in the 1830s and subsequently, and so that's why we call Royal Free, if you're wondering. We're very proud of our pioneering heritage. We were the first hospital in the 1880s to train and accept women to train to be doctors, and we carry that pride with us today and that pioneering spirit. If you cut forward to the modern day, we were authorised as a foundation trust 10 years ago, so happy anniversary, and we became a group of hospitals in 2017. Many of you will know the fantastic Chase Farm, which opened in 2018. It's still one of the UK's newest hospitals, and we're very proud of all the work that we've done there. And as Mark has said, over the last couple of years, we have played the most extraordinary role in responding to the pandemic. So I quite like now to talk about the future. I could talk for hours about all the things that make up the Royal Free, but we thought it was important to share some of our ambition with you. So the first thing, of course, is it's really, really important to us as an organisation that we are world class in terms of both the treatment, healthcare that we provide, but also the research and the teaching that we do. And our vision, and the thing that makes the Royal Free really, really special, I think, is to try and bring that world class expertise to the local care of our patients, and to get that combination of globally recognised clinical expertise with really, really local friendly care. And that vision for me is what makes the Royal Free almost unique in its aspirations and its ambition. Of course, we also, how we deliver our care is really important. So the values that we aspire to be positively welcoming, actively respectful, clear communicators and visibly reassuring in all our interactions, both as colleagues and as in care providers, really, really important. And again, that matters to us. So we always think about this when we're setting our future strategies. I said I'd mention our sustainability, and if we can move on a slide, we do have a number of commitments that we have made in order to be more sustainable. One of our key governing objectives is to be sustainable. Vicky is going to talk to you later about financial sustainability, but carbon neutrality and reducing our footprint is something that really matters to us, and really matters to our staff. This is something that our staff often ask us to do more of. So here are some of the things that we're doing, and we will be doing more in the future. So thank you to all of those members of our Green Network for what you're doing. So let's just think about the group. As I said, we were formed 5 years ago, and what we really want to do is, of course, bring the best of the NHS to every patient. That's kind of what that mission is about. We are a group of 3 hospitals, but as you saw on that first slide, we operate over 70 different sites. The operating at scale but delivering local care really matters to us, and that operating at scale and collaboration allows us to make investments so that we can reduce unwarranted variation. Many of you listening will have heard presentations that people on this call have made before on what we call our clinical practice groups, where we're effectively standardising and digitising our clinical processes so that we can reduce the unwarranted variation in the care that people receive and the outcomes that they get. And that is really, really important to us. We are a digital hospital, and Chase Farm, of course, achieved the highest level of digital accreditation, something called HIMSS Level 7 last year. We're really proud of that. And putting in new electronic health records and patient record systems is really, really hard. So again, I want to pay tribute to all our staff that put in a new EPR last year. So thank you for that. So meanwhile, of course, as that slide just started to say, the NHS is under massive pressure, and you will all have seen the same headlines as me. So I don't need to dwell on those. It feels really difficult when you're working in the service to read those headlines, and we know that many of our patients are waiting much, much too long, and it affects every single one of us. And so to those of you that are listening, if you've had a long wait, we are genuinely sorry, and we are doing everything we can to make waiting time shorter. Let's just have another, if we go on to the next slide. So for us, that waiting means we have a huge demand for emergency care in the organisation. Over 900 patients visit one of our urgent or emergency centres a day. Our hospitals are super full, nearly 100% bed occupancy. That number needs to be much lower in order for us to kind of move patients through. You may not know it, but the Royal Free London is one of the busiest. We have one of the biggest cancer services in London, and see so many patients every day, and treat about 46,000 patients in the last year. So we're very busy. If there are 7 million, well, actually there are 7 million patients, 7 million patients recorded on the national waiting list. That translates to 5.5 million people, apparently. Our equivalent is 90,000, so we're a big chunk of the national number, and that really matters to us, but I'll come back to that. And of course, as I said, you know, our staff are working under colossal stress, really, and not only because it's so busy, but of course there is now a cost of living crisis, and that impacts people working in the NHS as well. So that we really worry about that. I'm very conscious of the time, so I'm going to just move on from the slides and talk to you about what we're doing in the future. So the hospital system under stress means that we have to move our patients through and get them home to where most of us would rather be looked after and get better more quickly. So we focus on trying to get patients back to their place of residence as quickly as possible. We have things called virtual wards, where effectively we can diagnose and treat more and more people at home now with our partners. And we're working very closely with primary care, with our community trust partners, with social care partners, to make sure that we really make the system work much better than it has done over the past couple of years. And working together as a group is really important, because of course as we get busy, sometimes that means that we don't have enough beds for urgent care, for treating planned care patients. So having something like Chase Farm Hospital as an elective centre that is purely there for planned surgeries is a fantastic asset, and we're very proud of it, and that allows us to continue our work even when we get busy. Similarly, Finchley Memorial Hospital a year ago was opened as a community diagnostic centre, and we've now done 60,000 imaging scans there, and that again allows us to provide more care for patients even when it's super busy. As I said, we are very focused on supporting our staff. We've thought a lot about how we provide physical and mental well-being support for our staff, and we're now thinking as well about how we make sure people are supported financially as we go through the winter, and that's really a big focus for us over the next 12 months. So those are some of the things that we're doing in the short term. Of course, working with our partners and working in the integrated care system is really important. We could never do any of this on our own. And in North Central London, which is the boroughs of Barnet, Enfield, Haringey, Camden and Islington, we have a number of partnerships. This describes the integrated care system and the integrated care board and all the bits that make up that. And we are absolutely focused on trying to make sure that care is as seamless as possible, and using this partnership to make sure that patients get the best that they can from the services that their tax pays for. So that's the integrated care system. We work with a number of partners very specifically within that system, and I just want to show you a slide which I hope is going to work, which is a little wheel, and these are some of the partners that we work with. So the North Middlesex Hospital, we have a very specific long-standing partnership with the North Mid to make sure that we provide more elective care, specialist care, and a number of other services across all the communities that we serve, and really to reduce the variation that some of those populations receive in service. And that relationship has some very clear ambitions, and so that's important. If you keep moving through the wheel, because I'm not going to have time to talk about each bit so much, but we work with the RNOH on musculoskeletal and orthopaedic surgery. We run something called the North London Partner Shared Services for our kind of what people used to call back office services, corporate support services. We run the elective orthopaedic network, which is out of Chase Farm with North Middlesex, Barnet, Royal Free consultants, and we participate in a number of clinical networks across North Central London. And we have a relationship with West Hertfordshire hospitals, which you may not have been expecting, but we've been working with them for a long time on our clinical practice groups. And we also have the same electronic patient record system. So we all went live last year with the same electronic patient record system, and we have a long relationship with West Herts, which is very, very productive. So those are our partners. Let's move on and just tell you some of the things that actually are happening, which would suggest that it's making a difference. So I'm going to talk to you about the waiting list. So do you remember I said there are nationally there are up to 7 million potential people waiting. Actually, some people are waiting more than once, which is why you'll have heard in the newspapers it's 5.5 million. That line is going up. But let's have a look at the Royal Free line, which is the orange line. And we have reduced our waiting list by about 8% over the last year, and that is down to the massive efforts of our staff and also the cooperation of our organisations across North London. So if there are partners listening, I want to say thank you very much for your help in helping us with what are very, very big waiting lists, because we're a very big organisation. And thank you to everyone for your continued efforts. But that is we are going to continue to make those efforts. Let's just skip on another slide. So it's always good to end these presentations with a feeling of hope that we can make things better. So here are some of the headlines that the Royal Free has participated in over the last couple of years. So I mentioned the Community Diagnostic Centre at Finchley. So we've now seen 60,000 patients in just over a year. Those of you that follow the news will know that Royal Free was one of the first hospitals in our infectious disease team, was instrumental in helping address the early stages of the monkeypox outbreak. And here are some of our amazing research trials that we're so proud of. And I'll let Tim take the glory on research after I finish speaking. And so the final slide I wanted to show you was just some of the things that people say. So, of course, there's an awful lot to complain about, and many people have been waiting, and that's really hard. But when it goes well, this is what people say to our staff. So I just want to say thank you to all our staff from all of us. This is really what it's about. And when we get care right, it's fantastic. And the empathy and kindness that people express, you can't buy that. It's really important. So I want to say thank you very much for listening. I'm going to now, I think, hand over to Tim. So Professor Tim Mayer, over to you.
Great, thanks very much, Caroline. Good evening, everybody. My name is Tim Mayer. I'm Professor of Experimental Cancer Medicine at UCL and also consultant in medical oncology at the Royal Free. And I have the huge privilege of being the first director of the NIHR Royal Free Clinical Research Facility. So next slide. So in the next 10 minutes, what I'm going to tell you about is, first of all, explain what is a clinical research facility and what role does it play in medical research. I'm going to describe how the Royal Free Clinical Research Facility was established, and then finally what the clinical research facility will provide for our patients and staff. Next slide. So in order to do that, I'm just going to describe something which is often referred to as the translational pipeline, which describes how drugs are developed from a concept in the laboratory into new medicines to treat the general population. So in the first place, there is discovery science, so understanding the basic mechanisms of disease, and that allows us to develop targeted treatments, which also occur initially in the laboratory in preclinical testing. Those that look promising, next slide, we'll move on to clinical research and transition through early phase clinical trials, through late phase clinical trials, and then health service evaluation, and then finally through to healthcare delivery. So next slide. So where does the CRF fit? No, sorry, back one. So the CRF fits into the early phase clinical trial delivery. So these are trials in which drugs are given to patients for the very first time. We're trying to make sure that they're safe, to understand the right dose, what are the side effects, and also looking for initial signs that these drugs actually do what they say on the tin and are potentially effective treatments. Now, these can be potentially high-risk studies. They need specialist expertise, and without a clinical research facility, it's very difficult to deliver this translational pipeline. And up until we had the CRF, we were not able to do this. I think it's also important to point out that this is not a linear path. This is dynamic, as indicated by the arrow. So there is constant flow of data and information back and forth from the clinic to the laboratory and back again. Next slide. So here at Royal Free, we're incredibly privileged to be associated and co-located with UCL, which is one of the leading biomedical research universities in the world. On the left, you've got a picture of the Pears building, which has already been mentioned. So this is recently opened new research institute, which houses the Institute for Immunity and Transplantation. And there are many institutes around at UCL who are developing new treatments. And having a clinical research facility allows us to evaluate these new treatments and ultimately translate them to clinical care for patients who attend the Royal Free Hospital. Next slide. So just to give, to make that a bit more real and put it in context, I'm going to give you a specific example of how this pipeline works. Haemophilia is a disease which is an area of international expertise at the Royal Free Hospital. As many of you will know, it's a genetic disease in which a faulty gene gives rise to a faulty protein, and that means that patients who have haemophilia, their blood doesn't clot because they miss this specific factor. The treatment for that is lifelong injections of this recombinant factor to stop them essentially bleeding to death. At the UCL, Amit Nathwani has pioneered the use of gene therapy to treat haemophilia, and this involves delivering a healthy gene in a virus into the patient, and that healthy gene will get incorporated into the genome of the patient and therefore continuously produce the correct version of the protein. Next slide. So having developed this concept and this therapeutic, this was tested in an early phase clinical trial. So this is exactly the type of relatively high risk trial that we do in the clinical research facility. And this was a successful study. It was published in the New England Journal of Medicine, which is the most prestigious medical journal. And as I said, the trial was positive. Next slide. And the results were highlighted in the BBC recently, having demonstrated that with a single injection of this treatment, you could essentially cure patients with haemophilia and relieve them of the commitment to do daily injections for the rest of their lives. So this is a really truly transformational treatment which was developed at UCL, tested, further developed clinically at the Royal Free Hospital, and now not only provides treatment to our local community, but has globally transformed the care of patients with haemophilia. So this is exactly the type of study which the clinical research facility will facilitate. Next slide. So the National Institute for Health and Care Research is a major fund of medical research, and they also fund clinical research facilities across the UK, and they regard the CRS infrastructure as playing a critical role in making the UK a global hub for life science. And in the past year, 2021, they've supported around 5 million studies, with nearly 20% being first in human trials. So these are the very early assessments of new drugs. And that research has leveraged an additional £144 million worth of funding from the life science industry and other funders. And critically, they were really important in delivering the nation's COVID response. So the majority of the phase 3 trials, which really led the world in new treatments for COVID, were run through clinical research facilities. Next slide. So how did the Royal Free develop a clinical research facility? Clearly, as I hope I've explained, these are essential pieces of research infrastructure. We wrote it into our initial research and development strategy in 2017. Unfortunately, COVID got in the way and put the whole development on hold. But ultimately, the space was allocated on the second floor of the hospital. The charity, Royal Free Charity, was absolutely critical in pump priming for the first year, which allowed us to open the facility in April 2021. And then in September, we submitted an application to NIHR, and we were all absolutely thrilled and delighted to be awarded just under £5 million to run the facility for the next 5 years, and that started in September, and we had the formal opening very recently last month. Next slide. So what will the facility do? So first of all, with the funding, we've been able to appoint an outstanding leadership team. So Kate Blackstone, our general manager, Nia Bose, the lead research nurse, and Lucy Shuttleworth, the quality assurance manager. And between them, they provide senior management, governance and oversight, which allows us to safely conduct high quality research in a very regulated environment. Next slide. And we've also been able to appoint a critical mass of research delivery staff. So this includes data managers, research nurses, pharmacy staff, and laboratory technicians. Next slide. And all of this will enable us to conduct more complex experimental studies like the one I explained in haemophilia. We specialise and have international expertise in other rare diseases, including amyloidosis, systemic sclerosis, and lysosomal storage disorders. So we get patients from across the country for these rare diseases and developing new treatments for them, but also importantly, developing new treatments for cancer, cardiovascular, renal disease and liver disease to serve our local population. After all, the majority of patients that we see suffer from these common conditions, and we clearly have a long way to go to improve these treatments for these conditions. Next slide. Another key component of the clinical research facility is training the next generation of clinical researchers. So this is a picture of Glorianne. She is a clinical research fellow who is funded by Cancer Research UK, and she's helping to coordinate this trial that you see on the left, which is looking at preoperative treatment for resectable liver cancer. And this is a trial which is sponsored by UCL, is led by the Royal Free, and Glorianne sees these patients in the clinical research facility. She takes blood samples and tissue samples and then walks a few hundred yards to the Pears building, where she works with my colleague, Professor Marla Mainai, and analyses the samples in order to try and understand how these treatments are working. And I think this is a great example how the co-location of UCL and the Royal Free provides a fantastic training ground for the next generation of clinical academics. Next slide, please. Our facility is not standing alone. We are part of an important network, the UK Clinical Research Facility Network, which in total comprises 54 clinical research facilities around the country, of which about half are funded by NIHR. And we are very privileged within UCL hospitals to actually have 4 NIHR funded facilities. So there's obviously the Royal Free, which is the most recently funded, but there was also an NIHR facility at Moorfields, Great Ormond Street, and University College Hospitals, and we now collaborate very closely together to develop training initiatives and also provide local projects to serve our community. Next slide. And last but not least, our main focus is to ensure equality and diversity and inclusion are embedded in everything we do. NIHR has just published its EDI strategy for the next 5 years, and if you're interested, you can find this online. We are also concurrently developing our own strategy for the CRF, which will be published in March next year, and we have already established a public and patient involvement and engagement group, which is very active and helping us to ensure that we do things that are relevant to our patient population. So I'm going to stop there. I'll happy to take questions at the end, but I think hopefully you'll appreciate that the development of the CRF at the Royal Free is really an important step in helping us to elevate our clinical research to the next level and really provide our local community with access to cutting-edge research and involvement in really innovative trials. So with that, thank you very much, and I'll hand you back to our chairperson.
Actually, it's to Vicky Clark, our Chief Finance Officer for Annual Report and Accounts. Vicky.
Thank you, Mark. I'm Vicky Clark, I'm Group Chief Finance Officer, and I'm just going to talk through the group's finances for the year ended the 31st of March 2022. So if we could just go on to the next slide, please. We had new external auditors this year, EY, and external audit undertook their reviews and concluded on two key aspects as normal. So they confirmed that the accounts gave a true and fair view of the group and the trust's affairs and had been properly prepared. And they concluded on our value for money. So they looked at value for money and confirmed that the trust had deployed resources to achieve planned and sustainable outcomes for taxpayers and for local people. So a good outcome all round from an audit perspective. Could we move on, please? So just some headlines. In 21-22, we delivered a financial surplus of £6 million. We were operating under a pandemic financial regime, which ensured that we were reimbursed for our COVID specific expenditure, and we were fully compliant with the expectations from NHS England in that regard. We spent nearly £72 million on capital, and I'll come to that a little bit later. We delivered 20.5 million of financial savings. So given the financial environment and given the pandemic environment, this was mainly in the areas of things like estates and facilities, contract reviews and negotiations and agency cost reductions. Could we just go on to the next slide, please? I won't spend long on this, but this is the summary that you'll be able to see in our accounts on our website of our comprehensive income for the year. And could we move on, please? And this is a summary of how we spent our money. So the majority of our income, 57%, so £559 million, came from clinical commissioning groups. So they are now integrated care boards, but as of 21-22, they were CCGs, and from NHS England for our more specialist care. So the CCG income for our core patient care and our specialised NHS England income for our more specialist care. So the rest of our income, a much smaller proportion, came from some direct reimbursements for expenditure that we'd incurred, education and training monies, private patient income and research and development income. So the majority of our income is core NHS England and CCG income. And on the expenditure side, as you'd expect, more than half of our money, just more than half of our money, pays for our brilliant staff, with the remainder being non-pay for things like drugs, dressings, consumables and costs such as interest and depreciation. Could we move on, please? So our expenditure increased. If you look at 2021 versus 21-22, it increased by £42 million. We spent nearly £50 million on costs directly relating to the pandemic. In particular, we mobilised additional critical care capacity at the Hampstead site, and we opened additional emergency bed capacity at Barnet, as well as spending money on infection prevention and control. Could we move on, please? So again, I'm not going to spend very long on this, but this you will see in our accounts on our website. It's our balance sheet or statement of financial position. And the key bits here are that you can see the money we've spent on our capital playing through, also on our buildings, on our equipment, which I'll come to, and also a healthy cash position, quite an increase in our cash position, which again related to the fact that we were funded during the pandemic to make sure that money wasn't a blocker to patient care during that period. If we could move on, please. Thank you. So here's a summary of how we spent our capital, £72 million of capital expenditure in total. And I think this summary here highlights that we try to get the right balance really of keeping our equipment and our buildings safe and up to date, as well as then trying to reinvest in taking things forward. So investing for the future and for improving efficiency, but also improving patient care. So you'll be pleased to know that a large element of this, about £20 million, went on building works to keep our buildings safe, fire compliant, electrically compliant, mechanically compliant. Similarly, nearly £20 million was spent on medical equipment, particularly imaging equipment and replacement, as well as our rolling replacement programme, keeping all of our equipment up to date and safe. And then in addition to that, we spent nearly £30 million on technology, in particular £13 million on the new electronic patient record, that Caroline and Mark referred to earlier on in this presentation. So that's quite a whistle-stop tour through our finances, but I will hand back to Mark.
Thank you, Vicky, our Chief Finance Officer, and massive thank you to Tim and to Caroline. I hope between our three main speakers today, you've got a sense of what a roller coaster year has been for us in terms of achievements and challenges, starting with operational performance through to looking really into the future with world-class science, and then our financial performance, which is the bedrock of everything we do. In the interest of time, we have 12 minutes left. I'm going to rattle through the questions. We received a number of questions in advance. Questions are also coming into the live Q&A function on Microsoft Teams. So I'll field them, not necessarily the order to come in, but in terms of how they marry up with some of the questions we received. So firstly, hopefully a straightforward one. We had a question from an attendee about us meeting virtually like this on Microsoft Teams. I apologize if some attendees have struggled to get into the Teams function. And we received a question in advance as well about when we will be able to meet in person. Well, our top priority is the safety of our staff and our patients, and it is precisely in line with our infection prevention and control guidelines that this meeting is being held virtually. But we hear you loud and clear, and we hope to run meetings in person again next year. But do please just bear with us. This is for everybody's safety, which was why we decided to hold this virtually. I'm going to go to Julie Hamilton, who is our Group Chief Nurse. Julie, I've got a couple of questions here which you may be able to address. Firstly, and this is foremost in people's minds, what are your plans for patient care should nursing staff decide on strike action?
Thank you very much, Mark, and thank you for the question as well that's been submitted. This is really on the forefront of all of our minds, both myself as the Chief Nurse, but also as the board, and we had an update at our recent board seminar in terms of the current position. So this is a national ballot by the Royal College of Nursing. We are yet to hear the outcome of that ballot, but we're expecting to hear this week what it will mean for us at RFL, but what it will mean across the country. When it is declared, and if it is declared, that the ballot has shown that there would be strike action by our nursing colleagues in the RCN, we will work really closely with our Royal College of Nursing colleagues to make sure that if it does happen, that we have a very minimum impact on care for our patients. We will both work closely with them, but we'll also make plans internally at the Trust in line with whatever processes and derogations are put in place and principles that are put in place across the country, but also in the region. What we want to try and do is to prevent any negative impact. There has been some discussions about it may look like a bank holiday, but we are yet to work through all of those items, Mark, once we get notification.
Thank you, Julie. Thank you for that. And I'm very pleased as chair of the Trust that we do have the plans and that we are maintaining a dialogue and relationship with our people and the union. Julie, may I stick with you? We've got another question, and it's about nurses and their training and career pathways. So I'll read it out. And this was a question submitted in advance. I know excellent carers would like to train as nurses but can't afford the academic fees. Are there any practical courses where trainee nurses could be paid like apprentices so that they can learn by experience and train while they work?
Thank you, Mark. I'm delighted by this question and delighted because we have other members of the population who are keen to join this amazing profession of being a registered nurse. I'm very proud that at RFL, alongside a number of other organisations, that we do have a number of options for members of the public and people who've got experience or no experience in coming to us and working with us and learning with us to become a registered nurse. We have three main types of entry. One is becoming a healthcare support worker with us, and that's a level 2 apprenticeship, and we've just recently advertised for this actually. And we've had almost 20 people successful in getting through from quite a large number of applicants who applied. We also have the pathway to become a trainee nursing associate and then to become a registered nursing associate, and this role is now registered with the NMC. And then thirdly, we do also now have a registered nurse degree apprenticeship. So many routes available, and really with the aim of widening participation and making sure that we have local population represented within our organisation.
That's fantastic, Julie. Amazing schemes that you've outlined there for what must be one of the most rewarding careers you could possibly have, as I'm sure you would agree, Julie, as our chief nurse. Caroline, may I bring you in on a couple of questions, please? So firstly, we have a question submitted live from a psychotherapist who said that they've seen many NHS consultants, doctors and nurses through Frontline 19 because there are too few psychotherapists in the NHS to help them. So why aren't therapists, like the person asking the question, being referred to directly by the NHS?
Thanks, Mark. So I suppose the first thing to say is one of the lasting effects of the pandemic is that we have put more and more talking therapy services in place for our staff. And there are many different ways of accessing those, including using organisations like Frontline 19. So and thanks to them. So in North London, we have each organisation provides talking therapies to their staff. Often they're by from our therapy staff, or often psychologists actually, who were patient facing during the pandemic. They became facing towards staff, and now there's a kind of blended service. And so each organisation runs those, but also we run a service across North London, generally they tend to be employed by us, so I can't answer the specific why don't we refer out more, but I know that we are doing much more in, and I'm guessing the sense of the question is, and there isn't enough, and I think that's right. It's why we call it out in you know, in our work, and say we are ever thinking about how much more we can do. But thank you for the question.
Thank you, Caroline. And sticking with you as Chief Executive, again, this is about how we work across systems, really. We've got a question here from the live audience. What can we do more to help patients once they're discharged at home?
So I suppose there's a couple of things to say on this, Mark. One is, of course, patients will only be discharged when their lead clinicians are happy that they're well enough to go back to their place of residence. Secondly, that we work a lot with local authorities to make sure that there's care there. So, for example, we have a particular what we call a pathway to help patients get home with additional domiciliary care, and we're working with councils to try and make sure there's enough of that. We work with our community partners to make sure that there's supported rehabilitation on the way home. And I think, you know, in times where the public sector is going to be increasingly short of cash, it's really important that we really work with our partners to make sure that we can kind of get patients home as effectively as possible. So again, I get a sense from behind the question there's more to do, but I can assure you we are doing absolutely loads at the moment, and it really matters to us in the hospital that the care that patients receive in their home is as good as possible.
Thank you, Caroline. May I come to you, Dr. Gillian Smith, who is our Chief Medical Officer. We've got a question about which was submitted in advance, which I'll read out, and it's about a local support group for diabetes. So can the Trust explain why this support group for diabetes has had their meeting room taken away from them and be told that they can only have 9 attendees? By not allowing the group to meet at Chase Farm, we are taking support and services away from individuals who need the support, either because they've been newly diagnosed or wish to learn more about their condition. Gillian.
Thank you, Mark. And first of all, I would just like to say we really do recognise how important the peer support of these groups is to patients in terms of coming to terms with new diagnoses of diabetes and also in optimising their diabetic control. But unfortunately, in line with infection prevention and control guidelines during the pandemic, we were in a position where we could no longer make the meeting rooms at Chase Farm available to public gatherings. I am pleased to say, however, that post-pandemic, the room has now been made available again to the diabetic support group, and the facilities team have been in touch to arrange a programme of meetings going forward. So we're very pleased to see these meetings being reinstituted again.
Thank you. Thank you very much, Gillian, for that clarification. We've got one more question in the live chat. Given a healthy financial surplus, can't we pay staff a bonus to reward them for their efforts during COVID? Not sure about what the financial surplus was, but Vicky, perhaps I could start with you.
Thank you. The NHS as a whole has got very set pay structure, so it is very difficult to pay bonuses like that. And in particular, working in systems, we don't want to be in a place where if a trust makes a surplus, a trust somewhere close to us makes a big surplus one year, they can pay their staff more than we can, and it sets off all sorts of difficulties. But what we do try to do is make sure that we are looking at investment in wellbeing initiatives to support our staff and initiatives to recognise our staff as much as we possibly can without that direct bonus payment, which we cannot make.
Thank you, Vicky. Thank you for that. We've got one more question, and I'll take this as our last question in our final couple of minutes. Integrated service networks, will that mean to include multidisciplinary medical practice? So Caroline, I think this is very much about how we stitch services together. Perhaps you or Gillian would like to take this.
Well, you've heard quite a lot from me, but I mean, effectively, I suppose there's two things to say. One is, one of the things that we really have tried to do across the Royal Free Group is make sure that we have the best possible pathway or journey through the system for our patients, and that is constructed by multidisciplinary groups of clinicians getting together with data and with patients to work out what the best possible services are for their population. So we try and do that across the group, and now we're trying to do it across the system. So I haven't read the question mark, but the clinical networks effectively are groups of multidisciplinary clinicians working across the system in their various specialties. So for example, urology, orthopedics, gynecology, and trying to make sure that the patient journey is of the highest quality and the most effective and efficient journey, so that there's less waste in the system and it's truly multidisciplinary. Gillian, do you want to add anything?
I think that's absolutely right. We are very much focusing on multi-professional working, but also a key focus of our integration is with the borough partnerships, so working with colleagues in primary care and in local authority to really make sure we're delivering the best care for the patients in the right place at the right time, often closer to home. And that's very much focused on a multidisciplinary approach.
Fantastic, thank you. And more to watch here, and particularly after the last health and the Healthcare Act, which has enabled more system working at this integrated level, which includes primary care and GPs as well. A great set of questions, some submitted in advance and some today from people attending our AMM, and I'm really grateful to you, and you've generated fantastic discussion there as well. So I'm going to close our question and answers and hand back to Sneha. Sneha.
Thank you everyone for attending the event, and thank you to all the presenters for sharing such great insights. If you experienced any technical or visual problems during this meeting is recorded and the link would be published on the website so that you can view it. And we will also be sending a survey out in the next couple of days to hear back from you. How did you find the event and what more would you like to see from us? So please do share feedback. It really helps us to plan these events better. And also, if you have any questions, concerns, or you'd want to get in touch with governors, there's a governors inbox would be shared with you, and we would like to hear from you as well. So thank you once again for participating in the AMM and attending it. And thank you to our staff once again and the speakers today. Really appreciate your time.